My name is Angela Maxwell Horn, and I'm the Fellowship Director for Developmental and Behavioral Pediatrics at Vanderbilt. I think doing a fellowship at Vanderbilt is unique because, one, it's in an amazing city. There's so much to do in Nashville, from the professional sports that are here, football, soccer, hockey, to Lower Broadway. And then at work, there's just so many amazing resources here. So there's the Peabody School, there's Triad, there's a lot of resources to tap into, and I think that makes doing a fellowship at Vanderbilt unique. We are looking for a fellow who's engaged, open to learning new things, and thinking outside the box. We are an innovative institution, and so there's always opportunities to come up with projects and do things that haven't been done before.
I'm Rachel Good. I'm one of the developmental pediatricians here at Vanderbilt. I've been here about 5 years. I am an assistant professor of pediatrics. I am also the assistant director of the fellowship program. Some of the other hats that I wear, I am the medical director of the Neonatal Development Clinic, or also known as the NICU Follow-Up Clinic. I am the core director of the pediatric residents when they come through our rotation, and I am the associate director of the Middle Tennessee portion of our LEND program. The Vanderbilt Consortium LEND, or the Leadership, Education, and Neurodevelopmental Disabilities and Other Related Disabilities program, it's a mouthful, is an interdisciplinary program for graduates of all levels of training. There's multiple programs throughout the United States, and we have been blessed to have this program for over 15 years now. But our fellows are part of this program usually within their first year of training, so that they can learn how to interact in a multidisciplinary aspect outside of what we do in our clinics. So they're interfacing with over 15 other types of professions, as well as self-advocates and family members. And they're learning how to think of developmental disabilities outside of a medical context. And they're also getting opportunities to teach and to be leaders and to advocate. So I love Vanderbilt. I actually sought to come to Vanderbilt and was blessed to be here. Vanderbilt is this place that has all these amazing opportunities. You have research opportunities and clinical education opportunities. You have a wide variety of knowledge and disciplines working together. And I think as a fellow, you get to tap into all of that. And it's not awkward. There's plenty of people that really want to give you their time and their experience and their expertise, and are really happy to do that. And within our program, we know how to support that, and we're really wanting to support that. And so I think that's one thing that sets us apart.
My name's Genesis Yanes. A couple of people call me Jenny. And I'm a third-year fellow in the Developmental Behavioral Pediatrics Fellowship. Yeah, so I actually did my general pediatrics residency training at Vanderbilt. So I spent some time, 3 years in that program. And when I was in that program, I actually got to rotate through our developmental behavioral pediatrics clinic. And that was actually my first exposure to developmental behavioral pediatrics. And I really fell in love with it. I fell in love with the team here. I really got to spend time with them in the clinic and with patients, and really admired their bedside manner and just their talent. And so it was an honor to be able to join them for the fellowship. So this is a great program overall. I think one of the things that we do really well is our multidisciplinary approach to the treatment of our complex patients. So we do work with a complex population who has different needs, And by using a multidisciplinary approach, we get to work with the therapists, the psychologists, and other specialists like our genetics specialists, sleep medicine, neurology, pulmonology, cardiology. And because we're here at Vanderbilt, we're able to speak to each other and connect with each other and really come up with a great all-around treatment plan for our kids. So I think the care that we provide here is really excellent because of that, because we're able to make this multifaceted plan and hopefully one of the best treatment plans for our patients. Yeah, so what sticks out to me the most is the relationships that I've built during my fellowship. Again, we have a wonderful team here, people who are very talented, very knowledgeable, different backgrounds, and I feel like we've been able to build really strong relationships, and through those relationships I've received great mentorship, and this has become like a second family to me. And so I'll be graduating soon, and I feel like I'm going to continue to carry these relationships with me, this mentorship, and continue to reach out to them whenever I have a question, and know that they're going to continue to support me. It's been great. I'm so happy with the training I've received here. I feel really well equipped as a soon-to-be developmental behavioral pediatrician. I feel like in this clinic we see a variety of patients, a variety of diagnoses, a variety of treatment plans. We take, again, a multifaceted approach to our patient care, and the 3 years that I've spent here, I've just gained so much knowledge and experience that I feel pretty good about stepping into the role of an attending physician. I would say that hands down, I recommend this program to anyone looking to join a developmental behavioral pediatrics fellowship program. All around, it's been a great experience, and I don't think you'll regret coming here, because there's just so many great things to do, so much to see and learn, so many different people to work with. Vanderbilt is definitely a leader in developmental behavioral pediatrics, and I think it'll be a great experience for anyone who comes here.
I'm Paul Dressler. I'm a developmental behavioral pediatrician. I'm also the clinic director of developmental medicine. So I'm primarily in a clinical role, so what I do is a lot of in-clinic teaching of the fellows. So they rotate with me during my clinics, and I supervise them during their clinics. And then I do some didactics with them, and then also help them around quality improvement. So the Rapid Assessment Clinic is a team-based clinic where we see 4 children in half a day, and they see multiple providers looking at the question of a possible autism spectrum disorder. And it's really allowed us to have a true interdisciplinary clinic while maintaining appropriate efficiency, so we can see as many kids as we can, and also keeping the admin side happy with our productivity. And it's actually been really positive, and the families really like it, and the providers also are really happy with it. So we're looking for fellows that are open to new ideas of doing things, as well as fellows that value some level of independent thinking and independent care of patients, because we want them to take ownership of the patients they're managing in clinic.
So I'm Kristen Euland. I'm just finishing up my first year of fellowship here at Vanderbilt. So I'm a first-year developmental pediatrics fellow. At first, all I really knew about Vanderbilt was that it had a good reputation and a good name. It was known for providing good medical care. And then when I got further into the field of development, I realized that a lot of the assessment tools that we use for autism, like the STAT and the tele-ASD-PEDS, were developed at Vanderbilt. So I figured they must have a good developmental medicine program as well. And then what sealed the deal for me was when I did my interview for fellowship for the Developmental and Behavioral Pediatrics Fellowship. And even though it was virtual, I still feel like I got a good sense of the faculty, and they all seemed very supportive and seemed like they really care about their fellows. So that sense that I got is kind of what led me to rank them number one. So that's what sealed the deal for me. Yeah, I definitely would. I feel like my perception of Vanderbilt before I came here has definitely held true since being here. The people are wonderful. I'm getting a lot of great experience, and I really like Nashville too. I had never been to Nashville before I moved here, so I didn't really know what to expect, but it's been a cool city so far.
So my name is Dr. Zachary Warren. I'm a clinical psychologist and professor of pediatrics. I'm also the division director of developmental medicine and the executive director of our autism institute called Triad. The real advantage of Vanderbilt is the synthesis of both exceptional clinical care and an impressive research infrastructure. That is particularly the case for those that are working in the field of developmental disabilities. There are a number of opportunities to collaborate within the Department of Pediatrics and beyond, particularly for our trainees. One of the most exceptional sort of opportunities and resources is the Vanderbilt Kennedy Center. It houses an Intellectual and Developmental Disabilities Research Center, a USET, a LIN program, and our Autism Institute. All of those entities share a mission of training the future workforce and establishing research infrastructure for new investigators to launch programs of meaning. The Kennedy Center is the organizing force of developmental disabilities research here at Vanderbilt. It pulls together clinicians, policy folks who are doing sort of basic research to people who are doing very applied research. It provides training opportunities, research infrastructure, and also connections to our clinical communities.